We have the pleasure to interview our patient Bonifacia Palang, who actually came here 2 weeks ago and was initially diagnosed with breast cancer in 2007. At the time, she underwent the mastectomy and conventional treatments, although she decided to refuse chemotherapy. In 2008, she started to have some problems, and further down the road, she was basically diagnosed with spinal cord compression and was actually treated in Stanford Hospital with decompression of her spinal cord in last October. She finished the course of radiation therapy to her spinal cord just recently, finished about a month ago. She came here on the day of her arrival. She had significant pain in her back, lower back, and her pelvic area, which was consistent with the findings in her CT scan showing that she has extensive metastases to her vertebral bones as well as her hip. We started her on the treatment as soon as we saw her after drawing her initial labs, and sure enough, after a few treatments, she's gonna share with you what she experienced here. The pain was gone, and also the tumor markers, all her three tumor markers, which were significantly high before starting the treatment, they all have dropped significantly just in a matter of few days after the therapy. We started her on epigenetic IV therapies along with hyperbaric oxygen, which shows a very significant response in most of my breast cancer patients. Bonifacia, please share your story.
I'm Bonifacia Palahang. I'm 51 years old. I was diagnosed with breast cancer 2007. I have mastectomy bilateral. Then after they introduced me for chemotherapy, but I refused. I continue on working. Then after that, 4 years later, I have experienced pains. Then the doctor told me to have this scan. Then they find out that I have a tumor in my spine. Then they ordered emergency surgery.
Mm-hmm.
Then after that, they ordered radiation therapy for 2 weeks. Then it seems to me it not working at all. I'm still in pain, and so I have read in a website. Then I find out the treatment of Dr.Nezami. Then he started the treatment. Then a week after, I find good. All my pains were gone, and I'm getting stronger. So the therapy is already working, as I have noticed, and I feel it.
Mm-hmm.
So I'm determined to continue the treatment to have my cancer tumors will be gone.
Yeah, this is
So,
great. Just like you said, most of the time, patients when they come here, it's a matter of destiny because unfortunately there are not too many other physicians in conventional world, at least, that they are either trained or aware of such therapies, and in her case she responded in a matter of few days, and I have never personally encountered in the conventional methods of treating cancer such a significant quick response. And that said, she never even experienced any side effects. As a matter of fact, her quality of life and her function improved, and you heard her saying that her pain went away. And this cannot be more rewarding for a physician like me to see a patient getting such a good response. And when I see her every day, it just reminds me of how basically a person who has just trusted God in her destiny has found a treatment that can work for her, and it just makes my day. So Thank you for sharing the information. Do you have any messages for the public, for the people who are listening to you and they're looking at you and they have probably cancer or they have relatives with cancer?
Yeah, yes. So for all the people that has cancer, I'm encouraging you to go the treatment here because it's really working and it's really amazing, you know. So
Thank you.
please come over here and have the
Thank you.
treatment.
Thank you. Thank you so much, and I look forward to see you every day getting better.
Okay, thank you, doctor.
Thank you.